Okay. Can everyone see that?
Yes.
Okay, perfect. So thank you for being here. I am presenting my thesis in managing migraine, yoga therapy as an integrative approach. First, I want to start by defining what a migraine is. A migraine is a headache that can cause moderate to severe throbbing pain or a pulsing sensation, usually on one side of the head. It can be aggravated by routine physical activity, and it's associated with nausea and/or photophobia and phonophobia. According to the International Classification of Headache Disorders, there are two types of migraine: migraine without aura and migraine with aura. An aura is characterized by recurring attacks lasting minutes of fully reversible visual, sensory, speech, or other central nervous system symptoms that usually develop gradually and are followed by a headache and associated migraine symptoms. The most common type of aura is visual aura. Some people also experience a premonitory phase occurring hours or a day or two before the headache, and the headache resolution phase, which can have symptoms including hyperactivity, hypoactivity, depression, cravings for particular foods, repetitive yawning, fatigue, and neck stiffness and/or pain. Some facts about migraines: it occurs in about 15% of the general population. It is widespread and it can have a substantial burden of illness. It is ranked the 6th leading cause of disability worldwide in 2013. Migraines can limit health, quality of life, productivity, and financial security. In the USA, migraine headaches contribute to 86.5 million lost workdays each year. It is estimated that 28% of females and 17.7% of males lost over 10% of days due to migraines. Treatments for migraines can vary depending on the approach taken. A pathogenesis approach, the one that you see on the left, is based on understanding the causes and consequences of disease. The idea behind it is that by studying sickness, there can be an understanding of health. It is reactive, as again, it looks at the absence of disease and it treats pain. In contrast, in a salutogenic approach, the emphasis is on internal healing resources and the potential for active adaptation to new circumstances. It asks the question, what causes health? The aim of both approaches is to attain good health. However, a salutogenesis approach focuses on positive aspects. Health in this model is considered as a position on illness and wellness continuum, instead of positioning health and disease opposite to each other. So here we have the illness wellness continuum. You can see it goes from 0 to 10, premature death, disability, all the way to high level wellness and growth. And wherever an individual is on this scale, what a salutogenic approach tries to do is to take an individual towards high level wellness and growth. So how can yoga take us towards health if we look at it in a salutogenic approach? Yoga proposes several psychological and biological mechanisms in which it can take one towards growth. The first column, psychological, it helps with self-awareness, coping mechanisms, appraisal of control, calmness, spirituality, compassion, mindfulness. And on the biological side, it has an effect on the autonomic nervous system, decreasing the sympathetic response, the downregulation of the HPA axis. It improves endothelial function. It releases nitric oxide. It improves inflammatory responses and modulated limbic system activity. From a yogic perspective, if we look at the Hatha Yoga Pradipika, it says hiccups, asthma, coughs, headache, ear and eye pain, and various other diseases are due to disturbances of the vital air. Healthy processors are the outcome of harmonious interaction of these vital airs, also known as the Pancha Prana. We have 5 vital airs. These are known as prana, which governs the heart region and cardiorespiratory function, apana, which is responsible for elimination. Udana governs communication and thought processes. Samana is responsible for digestion and assimilation. And Vyana pervades the entire body and it's in charge of circulation. According to the Yoga Vashishta, if there is disturbances in the pranavayu, serious illnesses arise. Adi, psychic disorders, and Vyadi illnesses are caused by ignorance and its concomitant total absence of mental restraint, confusion, irregular activities, unhealthy habits, and the weakening of the nadi channels, thus preventing the free flow of life force. Adi and Vyadi can be remedied by attaining self-knowledge, knowledge of truth, and right action. Additionally, in Patanjali Yoga Sutras, it says that the symptoms or manifestations of a distracted state are mental pain, despair, trembling of the body, and disturbed breathing. If at this stage an individual can realize that there is something wrong, for example, dysfunctional breathing pattern, a diet that promotes weight gain, pain, etc., one may be able to make the necessary changes to correct the imbalance and possibly prevent disease. So this brings me to my 8-week online yoga therapy program. I wanted to put all these things together into practice, and I created this program with IRB approval for participants were enrolled. The program took place via Zoom, and we met 2 times per week for 60-minute sessions. The goals of this program were to reduce intensity, frequency, and duration of migraines, provide tools for improving emotional health, reduce muscle tension along the head, neck, and shoulders, and to implement a consistent yoga practice. The program components. The first one was to implement a daily routine, also known as dinacharya. Some of the most common triggers for migraine headaches are stress, food, fasting, sleep deprivation, and change in weather conditions. Lifestyle modifications are essential for managing chronic ailments such as migraine. They include developing healthy habits, proper diet, stress adaptability, sleep habits, and hygiene. So for this program, I implemented these 3 main points: sleep hygiene routine, tongue cleansing, and journaling. Studies support the evidence that migraineurs have worse sleep quality than non-migraineurs. So having a consistent time for going to bed, waking up, no electronics, setting a relaxing environment was very important for this population. Tongue cleansing was also implemented either in the morning and at night. The symptoms and comorbidities accompanying migraines can possibly affect oral health and care, hence why implementing healthy oral care habits might be helpful for this population. And the third one, journaling. Participants were given a prompt to fill out every night for the 8 weeks that consider several factors such as hydration, sleep quality and quantity, screen time, and other things and factors that might affect migraines. The purpose of this was to observe and see their current lifestyle habits and see if they could cultivate that awareness and that bare observation into what might be triggering their migraines. The second component was asana. This practice was broken into 2. The first part was to implement sukshma vyayama, which are subtle exercises that require continuous attention to proprioception induced by slow movements. Asana might be helpful because it helps move stagnant energy and relieve tension. Focus was placed on grounding and drawing the pranic energy and their subdivisions away from the head and down towards the feet. We wanted to encourage the movement of the downward vital air of apana or elimination, since they had too much energy going on around their head. Postures that strongly engage apana and the activation of it that help anchor the body and allow for a smooth flow of energy. We had forward folds, seated twist, Vajrasana, Dandasana. Here you can see child's pose, standing poses where they could really send the focus on their feet. And of course, Shavasana to encourage them to be in their body. We have Brahma Mudra. This is traditional yoga practice from the Gitananda tradition that involves movements of the neck in 4 different directions, synchronized with the breath and audible chantings of bija mantras. This produces psychological changes in the participants' respective systems, resulting in homeostasis. Results in a study show that after 6 weeks of practice, the Brahma Mudra group had a significant reduction in pain, improved proprioception, and improved functional cervical mobility. Here you can see the steps 1 to 8. You inhale and turn to the right for 4 to 6 seconds. And as you exhale and come back to center, you chant ah. You turn to the left. And as you exhale, you chant ooh. Then you tilt your head upwards and you chant E. Then you tilt your chin downwards. And as you come back to center, you chant The focus of this practice was to really focus on the movement of the neck, the sound, the breath, and the subtle vibrations that happen afterwards. Pranava Pranayama was also implemented. Om chanting has been shown to balance the autonomic nervous system, regulate the vital parameters, and bring individual to a relaxed mental state. We chanted the A sound 3 times, the U sound 3 times, the sound 3 times, and then lastly, the full sound of Om 3 times. That practice was also from the Gitananda tradition as well. We also implemented Brahmari Pranayama. Pranayama may be particularly beneficial for headaches and in particular for migraines because studies have shown the improvement of nitric oxide. Nitric oxide plays a key role in regulating brain metabolisms, cerebral circulation, and blood vessel function. Nitric oxide mediates flow-mediated vasodilation and opposes vasoconstrictor effects. Repeated exercises that increase nitric oxide and sustain its levels within the blood have been demonstrated to decrease migraine frequency, severity, and duration. The practice consisted of inhaling, and while the participant exhaled, making the humming sound of a bee. Placing again focus on the subtle vibration and the subtle sound that comes afterwards, and really notice their emotions, thoughts, and any sensation that may arise. Lastly, we have meditation, and this meditation had 2 components. The first one was progressive muscle relaxation, or PMR. A conscious focus on breathing or muscle tension helps the individual become more cognizant of their bodily responses when anxiety arises and allows them to consciously relax. It can result in a 30 to 40% decline in frequency of headaches, and it uses neuronal top-down and bottom-up processing. The second part was Yoga Nidra. Yoga Nidra is a practice that provides deep psychological and physical relaxation while maintaining mental functions alert. They include making mental resolutions or setting an intention, initiating rotation of consciousness through the body, practicing breath awareness, relaxing the mind and emotions, visualizing, and reaffirming the mental resolutions or intentions. This practice reflects an integrative response by the hypothalamus, resulting in increased parasympathetic function. Through these meditations, we cultivated pratyahara, or the inward flow of the senses. It allowed participants to cultivate a sense of being and just allowing them again to be in their body without having to do or change anything. For this program, I had several assessment measures. I had a measurement of frequency and intensity of migraine attacks, a headache impact test. The headache impact test is a headache-specific questionnaire which evaluates how headaches affect someone's ability to function on the job, at home, and in social situations. The headache impact test ranges from 36, being no headache, to 78, very severe headache. A higher score indicates a greater impact of headaches on quality of life. It asks things such as how often do headaches limit your ability to do daily activities? How often do you wish you could lie down? How often do you feel too tired to do work or daily activities because of your headache? How often do you feel fed up or irritated because of your headache? We also did a musculoskeletal screening and a breath assessment. So now for the results of this 8-week yoga program. For the headache impact test, as you can see on the left, we have the baseline scores, and on the right, the post-intervention scores. All of them decrease for 3 participants. The last participant, her scores remained the same. She reported that she had changed job positions, and this new job had required her to have more screen time on the computer, and that had contributed to more headaches. However, as you can see here in the pain intensity scores table, all of the participants reduced their pain when having a migraine, going from 7 to 3, 7 to 4, 10 to 5, 4 to 2. We also did in the musculoskeletal and breath assessment, all participants improved range of motion and cervical mobility. Previously in the first assessment, they all had reported pain when doing cervical motion and the feeling of tension, and also their range of motion increased in their final assessment. All participants also improved their maximum phonation time, or the OM test, where it was measured the length of the exhalation. They all extended their exhalation at the end of the program. In addition, participants increased body awareness and proprioception. It appears that they have found more benefit from yoga nidra and the pranayamas, creating a sense of beingness and not doing, and allowing them to connect to that essential essence of consciousness and being, which is not treating a disease process. It gave them the experience of recognizing that they are not their disease. It gave them self-agency to do things on their own, and that in itself is yoga. Here I have some comments of patient perspective. Through this program, I learned different forms of yoga that helped me with stress management, fatigue, and most importantly, to improve my breathing capacity. After a previous surgery, I was left with diminished lung capacity, and I never did rehabilitation. Pranayama really helped me get in touch with my breath again. Participants see the most valuable thing I learned was to breathe with proper form, and how it helped me to be aware of myself, to look inward and be able to control my mind and body. There's always room for improvement, and I have it in me to do so. I just need to take the time to meditate and do my part to feel better. I had never seen yoga in the way I see it now, especially since it has given me the solution to a problem that has taken me years to learn with. That is priceless. And lastly, my last slide, where do we go from here? Yoga therapy in a salutogenic approach helps to mitigate the suffering that is associated with migraine, and that should be considered from this philosophical perspective on health versus just the clinical data-driven. More research in this area is needed, particularly yoga therapy delivered online for migraine headaches. A randomized controlled trial with larger sample sizes, multiple patient-reported outcomes may be useful to assess the overall effectiveness of online yoga therapy. But despite the limited evidence, yoga therapy shows promise as a feasible complementary therapy for migraine headaches. Thank you so much for being part of this presentation and listening.